Welcome to the Aced It podcast, where we turn science into sense. This is our 12th season of Aced It, and we're brought to you via the Justice Community Overdose Innovation Network, or JCOIN. I would like to celebrate a bit this season, for as we start season 12, we've reached 21,000 downloads and counting. Woohoo! Yeah, not because we're famous, certainly not, but because that means at least 21,000 times our listeners have learned something about overdose, opioids, opioid use disorder, medication-assisted treatment, and/or harm reduction. And that, my friends, warms my very grateful heart. Also, just a quick plug for a few other JCOIN features that you might not know about. Did you know you can get technical assistance for your organization from the experts at JCOIN for free? And did you know you can apply for small research grants to help fund innovative study ideas? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator to improve your own skills? Also through JCOIN. If you didn't know about these things, check out our website, jcoinctc.org, and learn about the many JCOIN offerings beyond Aced It that may help you learn and grow in ways that improve lives. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. And here we are back again with season 12 on roles, responsibilities, and reactions to overdose. This is episode 8. And today we're diving into how schools and colleges are responding to the overdose crisis in real time. Today's episode confronts a pressing and often uncomfortable reality, the overdose crisis inside our schools. Our educational institutions, once seen as safe havens, are now on the front line of a public health emergency. So what does real preparedness look like in a school hallway or a college dorm? Who's trained? Who is equipped? Let's find out. Let's start with the numbers, because numbers tell a story of urgency. Between 2010 and 2021, adolescent overdose deaths more than doubled, according to D'Argio 2022. Likewise, Callahan and colleagues 2024 and Oether and Bultris 2024 show that it is not just because more kids are using drugs, it is because the drug supply is more deadly. We are talking about counterfeit pills, Xanax, oxycodone, Adderall, often laced with fentanyl. Sometimes a single pill is enough. The most haunting part, many of the teens who died didn't even have a known history of substance use, and being unprepared will not prevent it from happening again. So let's talk about who is positioned to notice red flags, intervene early, and administer life-saving care: school nurses. In McDonald and colleagues' 2020 study, school nurses across Pennsylvania were surveyed. More than half reported having naloxone on hand. A few had used it, and many wanted more training, more resources, and more support. Similarly, Pattison, Sharp, and colleagues' 2017 found that nearly 40% of nurses had encountered a student with an opioid prescription in the past year. Yet, less than 4% had access to naloxone. Why? Most cited institutional barriers were a lack of buy-in from administrators, no clear protocol, or fear of encouraging drug use. However, let's be clear. Equipping someone to respond to a medical emergency is not permission to misuse drugs. It is a harm reduction, prevention, and smart public health strategy, and school nurses get that. What they need is for leadership to get on board. In Delaware, a young man named Tyler died of an opioid overdose. His parents found attack addiction, which led to sweeping policy changes. King, 2016, documents how the state now requires naloxone in every public high school and empowers nurses to use it. It's a story of turning grief into advocacy, but also begs the question, why? Why do we wait for tragedy before we act when we already know what works? We have the data, we have the training tools, and we have the funding in some cases. What is often missing is the political will and the cultural shift required to treat overdoses like an emergency that it is, not a taboo. Higher education settings are not immune either. In fact, colleges may be even more vulnerable because of unsupervised living environments, pressure to perform, and exposure to risk-taking behaviors. However, some institutions are leading the way. Hill and colleagues, 2020, detail how the University of Texas at Austin created a cross-campus initiative where residence hall staff, police officers, peer educators, and pharmacists are all trained to respond to overdoses. It was not just about stocking naloxone. It was about normalizing its presence as part of campus safety. Another example, Vassar College. They have something called the AED Plus model, as detailed by Davis and Schnell at 2024. The AED Plus model actually did something radical. It treated naloxone like a defibrillator, visible, accessible, non-stigmatized. It told students, we care enough to be ready. That is the message every campus should send. So how do we move this forward? We teach. Doughty and colleagues 2020 evaluated a 30-minute student training on overdose response. The results? Students gained and retained confidence in identifying and responding to an overdose. Beyond that, they spread the word and told roommates, partners, and siblings. That is how culture shifts, through small conversations sparked by shared knowledge. Orther and Bultis 2024 underscore that education must start earlier, in middle school, not in response to crisis, but to prevent one. They call for school nurses to teach students how to recognize fake pills, resist peer pressure, and understand what an overdose actually looks like. This is not about scaring kids. It's about empowering them. What is the cost of a life? Cipriano and Zarek, 2018, ran the numbers. They found that if even one overdose death is prevented a year, school-based naloxone programs are cost-effective. But let's be clear. It's not about budget lines. It's about priorities. We invest in fire extinguishers, and we hope that we never use them. We train for earthquakes, hurricanes, and active shooters. We also train for CPR and first aid. Overdose is just another emergency that demands readiness, not excuses. So, here's what we know. After 10 studies and countless examples. 1. Overdose is happening on school grounds. 2. School nurses are ready, but they need more tools and more support. 3. Students want to learn, and they need to. 4. Naloxone works, education works, policy works. What's left is the will to act. With that, we have reached the end of our episode on educational settings, roles, responsibilities, and reactions to overdose. I learned a lot from this episode, and I hope you did too. I'll talk to you next time when we'll be talking about witnesses and bystanders. Thank you for listening to the ACE-IT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Roods, at Sam Houston State University. My email is droods, D-R-U-D-E-S, at shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's, Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters and also my fantastic doctoral students, Bryce Kushmerek-McCune and Jalen Magana. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Remember to check out our website, jcoinctc.org, for more cool JCoin features and opportunities. And tune in again soon for another episode of ACE-IT.